Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, what brings you in today?
Well, I've been experiencing some troubling symptoms over the past few months, and they seem to be getting worse. I thought it was best to come and see you about them.
I'm glad you decided to come in. Can you tell me more about what you're experiencing?
Sure. The most noticeable issue is my digestion. I've had constant bloating, stomach cramps, and irregular bowel movements. Sometimes it's diarrhea, and other times I can't go for days. I've also noticed blood in my stool occasionally.
That sounds concerning. How long have you been experiencing these symptoms?
It's been about 6 months. I thought it might be a dietary issue at first, so I tried cutting out different foods, but it hasn't helped much.
I see. Have you noticed any other symptoms alongside the digestive issues?
Yes, I've been feeling more tired than usual, and I've lost a bit of weight without really trying. I also sometimes feel a bit feverish and just generally unwell.
That could suggest an underlying inflammatory process. Did you notice anything else?
Yes, there's something else. I've also been having this constant pain in my lower back that sometimes radiates down my legs. I initially thought it might be due to poor posture at work since I'm at a desk all day, but it hasn't improved despite trying to sit more comfortably.
How long has the back pain been bothering you?
Around the same time as the digestive issues started. I didn't think they were related initially, but the pain has been persistent.
And on a scale from 1 to 10, how severe is the back pain?
I'd say it's about a 6 on average, but it sometimes flares up to an 8 or 9.
Have you tried any treatments for your back pain, such as physical therapy or medications?
I've been using over-the-counter pain relievers, which help a bit, but they don't take the pain away completely. I haven't tried physical therapy yet.
All right, and have you noticed any numbness or weakness in your legs?
Not exactly numbness, but sometimes my legs feel weaker, especially after standing for a while.
Given your symptoms, it would be important to investigate further. Your digestive issues might suggest inflammatory bowel disease or another gastrointestinal condition, and the back pain could indicate a problem with your spine or potentially related to the same systemic issue.
That sounds scary. What kinds of tests will you need to do?
We'll start with some blood tests to check for markers of inflammation and infection. I'll also recommend a colonoscopy to evaluate your intestines and see what's causing the blood in your stool. For your back pain, we might need imaging tests like an MRI to get a detailed view of your spine.
I hope it's nothing serious. It's been really affecting my quality of life.
I understand your concerns. We will do our best to find out what's causing these symptoms so we can treat them effectively. Once we have a diagnosis, we can discuss the best treatment options to help you feel better.
Thank you, doctor. I really appreciate your help with this.
You're welcome. Let's get started with the tests, and I'll follow up with you once we have the results.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor.
Good afternoon. How can I help you today?
I've been feeling dizzy and short of breath frequently over the past few months. Also, I have noticed swelling in my legs and abdomen that seems to be getting worse.
I'm sorry to hear that. Have you experienced any other symptoms such as fatigue, chest pain, or palpitations?
Yes, doctor. I'm tired all the time, and sometimes I feel my heart racing.
Have you noticed any changes in your weight recently?
Yes, I've gained around 15 pounds over the last 3 months, even though I haven't changed my diet or exercise habits.
Do you have a history of heart disease or other chronic conditions?
I have high blood pressure, which I've been managing with medication. My father had a heart attack when he was in his 50s.
Do you currently take any medications other than those for your blood pressure?
Just the blood pressure meds and some over-the-counter pain relievers for occasional headaches.
How is your activity level? Do you exercise regularly?
Not really. I used to go for walks, but I've been too tired lately.
Understood. Do you drink alcohol or smoke?
I don't smoke, and I rarely drink.
Thank you for the information. I'd like to conduct a physical examination to gather more insights into your symptoms.
Okay, doctor.
On examination, I notice swelling in your legs and abdomen, which suggests fluid retention. Your heart rate is 95 beats per minute, and your blood pressure is 145/95 millimeter Hrdrangs. Your lungs sound clear, but I can hear a gallop rhythm in your heart, which can be a sign of heart failure. I recommend that we conduct some tests, including blood tests, an ECG, and an echocardiogram to understand your condition better.
I see. What do you think it could be?
Your symptoms and examination findings suggest the possibility of heart failure. The tests will help us confirm the diagnosis and determine the best course of treatment.
That sounds serious. How will it affect my life?
It is a serious condition, but with proper treatment, many people live well with heart failure. We will focus on managing your symptoms and preventing further complications. You will need to take medications, follow a low-sodium diet, and monitor your fluid intake. Regular exercise like walking can also help.
What about the dizziness and shortness of breath?
These symptoms are likely due to fluid buildup in your lungs and body. With the right treatment, we aim to reduce the fluid buildup, which should improve your symptoms.
What kind of medications will I need to take?
You'll likely need diuretics to help remove the excess fluid, medications to reduce the workload on your heart, and possibly other drugs to manage your blood pressure and heart rate.
Will I need surgery?
Surgery isn't usually needed for heart failure unless there's a specific issue, like a blocked artery or a valve problem that can be corrected. We'll see what the tests show before making any decisions.
I'm nervous about all this, doctor.
It's natural to feel that way, but you're not alone in this. We have a great team of specialists who will support you every step of the way. I'll arrange the necessary tests and set up an appointment for you to see a cardiologist.
Thank you, doctor. I appreciate your help.
You're welcome. Take care, and let's work together to get you back to better health.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Hello, I'm Dr. Nguyen. How are you feeling today, Mrs. Roberts?
I'm a bit anxious, doctor. My migraines have been worse recently, and the painkillers don't seem to be working.
I'm sorry to hear that. Let's discuss your symptoms in detail. How long have you been experiencing these more intense headaches?
It's been about 2 weeks now. The pain is intense, and I sometimes feel nauseous too.
I see. Are there any specific triggers that make your migraines worse?
Not really. They just come and go unpredictably.
All right. I suggest we adjust your treatment plan. We can try a different medication and also refer you to a neurologist for further evaluation if necessary.
I'd really appreciate that. The pain is becoming unbearable.
We'll do our best to manage it. I'll write a new prescription and arrange a referral. Remember to stay hydrated and rest whenever you feel a headache coming on.
Now look at question 26.
Hello, I'm Dr. Smith, one of the orthopedic surgeons. How is Mrs. Green doing after her hip surgery?
Hi, Dr. Smith. She's doing okay, but she's in a lot of pain and is worried about her recovery.
It's natural to feel that way. How is her mobility? Is she able to move around with assistance?
Yes, she's able to walk a little with the walker, but feels weak and unsteady.
We'll keep monitoring her closely and adjust her pain management plan. It's important to start with gentle physiotherapy soon to regain her strength.
I agree. Her daughter is very concerned and wants to know how soon she can be back on her feet.
Recovery is different for everyone, but with consistent therapy, we aim for a few weeks before she can walk more comfortably. Please reassure her daughter that we're doing everything to ensure a smooth recovery.
Thank you. I'll let her know, and we'll keep a close eye on her progress.
Now look at question 27.
So, Dr. Patel, could you explain your approach to managing Mr. Anderson's hypertension?
Of course. After evaluating his medical history, lifestyle, and current medication, I plan to start him on an ACE inhibitor. He also needs to adopt dietary changes, focusing on reducing sodium intake.
A comprehensive approach, and why choose an ACE inhibitor?
Based on his blood pressure readings and the absence of contraindications, an ACE inhibitor is a suitable first-line treatment. It's also beneficial, given his history of diabetes.
Precisely. And what lifestyle advice would you provide?
Apart from diet modifications, I suggest regular exercise, smoking cessation, and reducing alcohol intake. These can all contribute to better control of hypertension.
Well considered, Dr. Patel. Consistency in these areas, alongside medication adherence, is crucial for managing hypertension effectively.
Now look at question 28.
Maya, how would you approach educating patients about proper wound care after surgery?
Education is crucial for preventing infections. I'd begin by explaining the importance of hand hygiene before touching the wound. Then I'd provide detailed instructions on how to clean and dress the wound, highlighting the importance of using sterile materials.
Good start. What should patients avoid to prevent wound complications?
They should avoid soaking the wound in water, like during baths, as it increases the risk of infection. Also, I'd advise against using unapproved creams or ointments without consulting a healthcare professional.
Exactly. And what would you suggest if a patient notices signs of infection?
I'd advise them to immediately contact their healthcare provider if they notice increased redness, swelling, discharge, or a fever, as these could indicate an infection that needs prompt medical attention.
Great advice, Maya. Empowering patients with knowledge is key to ensuring their safe recovery.
Now look at question 29.
Dr. Carter, I've been working with Ms. Davis, and she seems to be having difficulty managing her chronic pain.
Has she mentioned any specific factors that intensify the pain?
She mentioned that any physical activity, even light household chores, significantly worsens her pain. She's also been struggling to sleep, which compounds the problem.
It's a tough cycle to break when pain affects sleep and vice versa. Have you considered a multidisciplinary approach to her treatment?
Yes, I'm discussing a pain management plan that includes physical therapy, mindfulness techniques, and medication adjustments. I'm also considering referring her to a pain specialist.
A multidisciplinary approach can help address different aspects of chronic pain. Regular follow-ups to assess her progress will be essential.
Definitely. I'll keep close tabs on her progress to ensure we're on the right track.
Now look at question 30.
Dr. Lee, what do you think is the most effective way to improve compliance with hand hygiene practices among healthcare workers?
I think emphasizing education and awareness is key. Regular training sessions that explain the impact of good hand hygiene on patient outcomes can be compelling.
I agree. Repetition is also important. Posting reminders near sinks and hand sanitizer stations helps reinforce the message.
Another useful strategy is incorporating hand hygiene audits and providing feedback. Positive reinforcement for good practices can motivate compliance.
And it's vital to make hand hygiene convenient. Placing sanitizer dispensers strategically in high-traffic areas and ensuring soap and paper towels are always available can encourage usage.
Absolutely. Hand hygiene practices must become second nature to all healthcare workers. It's one of the simplest yet most effective ways to prevent the spread of infections.
Indeed, a collective effort towards maintaining high hygiene standards benefits everyone in the healthcare setting.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, we're privileged to host Dr. Sarah Martinez, a renowned public health expert who recently conducted a significant study on maternal health care in rural Africa. Dr. Martinez, could you share the importance of your study and why you chose to focus on rural Africa?
Absolutely, and thank you for having me. The decision to focus on rural Africa stemmed from the high rates of maternal mortality and the unique challenges faced by these communities. While maternal health care is a global issue, women in rural Africa often encounter barriers that differ significantly from those in urban areas or developed countries. I felt compelled to understand these obstacles and how they could be addressed to improve maternal health outcomes.
What were some of the key differences you observed in maternal health care between rural African communities and more developed regions?
One of the most striking differences was access to healthcare facilities and trained medical personnel. In many developed regions, women can access prenatal and postnatal care with relative ease. However, in rural Africa, many women have to travel long distances to reach the nearest clinic, often on foot or by motorcycle over rough terrain. the lack of trained healthcare workers in these areas compounds the issue, leading to significant delays in receiving necessary medical attention. Furthermore, cultural beliefs often play a role in shaping attitudes toward childbirth, with some communities prioritizing traditional birthing practices over modern medical care.
How do these challenges impact maternal health outcomes in these communities?
The impact is profound. The combination of limited access to healthcare facilities, a shortage of trained professionals, and cultural influences often leads to late diagnosis and treatment of pregnancy-related complications. This delay increases the risk of maternal mortality and morbidity. Additionally, inadequate prenatal care can lead to complications for both the mother and the baby, resulting in high rates of neonatal mortality. Without proper interventions, these outcomes will likely persist.
Were there any specific cases that made a lasting impression on you during your research?
Yes, one story that stands out is that of Amina, a young woman who walked for 2 days to reach the nearest clinic while in labor. By the time she arrived, she was exhausted and suffering from severe dehydration. Fortunately, the clinic staff managed to provide her with emergency care, and she delivered a healthy baby. However, Amina's experience highlights the urgent need for improved infrastructure and healthcare access in rural areas. No woman should have to endure such hardship to receive basic medical care.
It sounds like a challenging environment to conduct research. What obstacles did you face during your study?
Navigating the remote regions was challenging as many areas lacked proper roads. Coordinating with local leaders and gaining the trust of the communities took time and effort, especially given the sensitivity surrounding maternal health. The language barrier was another obstacle, but with the help of local translators and community health workers, we managed to collect valuable data. These hurdles emphasize the importance of collaboration and local partnerships in conducting successful research.
For researchers and healthcare workers looking to make a difference in maternal health care in similar settings, what advice would you offer?
It's crucial to approach this work with cultural humility and respect. Understanding the local context, including traditional practices and beliefs, is vital for effective communication and intervention. Building relationships with local healthcare workers and community leaders can also facilitate trust and cooperation. Flexibility is key, as conditions can vary widely even within a region. Ultimately, the focus should always be on empowering local communities to sustain improvements in maternal health care.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome everyone to our healthcare discussion today. Joining us is Dr. Andrew Patel, an infectious disease specialist from Johns Hopkins University. Dr. Patel is here to shed light on recent developments in infectious disease management, particularly in the context of emerging pathogens. Dr. Patel, thank you for being here today. What can you tell us about your recent studies?
Thank you for having me. Infectious diseases remain a significant public health challenge, with emerging pathogens frequently catching us off guard. Our recent studies have focused on improving diagnostic capabilities and treatment strategies for emerging infections. One area we've extensively researched is the resurgence of antibiotic-resistant infections. The alarming rise of multi-drug-resistant organisms, MDROs, is a global concern, and our studies emphasize the need for novel treatment approaches and enhanced antimicrobial stewardship.
Antibiotic resistance is a topic that frequently comes up in healthcare discussions. Can you elaborate on what your research has found?
Certainly. We've observed that the overuse and misuse of antibiotics remain significant drivers of resistance. In our studies, we found that antimicrobial stewardship programs, ASPs, which promote the responsible use of antibiotics, have been effective in reducing resistance rates in hospital settings. These programs emphasize accurate diagnosis, choosing the right antibiotic, and optimal dosing durations to minimize resistance development. We've also been researching phage therapy, an innovative treatment using bacteriophages to target specific bacteria, which could offer an alternative to antibiotics in certain cases. While still experimental, phage therapy shows promise in treating infections that are resistant to multiple antibiotics.
That's interesting. Beyond antibiotic resistance, what other trends have you noticed in infectious disease management?
We're seeing significant progress in rapid diagnostics. Point-of-care tests and advanced molecular diagnostics have shortened the time to identify pathogens, allowing for quicker treatment decisions. This is particularly important for viral infections, where early detection can prevent outbreaks and enable timely antiviral administration. Vaccination strategies have also evolved. For instance, recent developments in mRNA vaccine technology have opened up new possibilities, not just for COVID-19, but for other infectious diseases like influenza. Research into broadly protective vaccines, which target multiple strains of a virus, is another exciting area.
Rapid diagnostics and vaccine advancements certainly have a big impact. What challenges remain in managing emerging infections?
One of the biggest challenges is the unpredictability of emerging infections. We often don't know where or when the next outbreak will occur. Rapid identification and response are crucial, but infrastructure varies greatly across different regions. Strengthening global surveillance networks and improving access to diagnostics and treatments is essential. Additionally, misinformation and vaccine hesitancy can undermine public health efforts. Effective communication and public engagement are needed to counter misconceptions and build trust in science.
What advice do you have for the general public to better understand and respond to these challenges?
Public education is crucial. Understanding the importance of vaccines and responsible antibiotic use can go a long way in preventing the spread of infections and reducing resistance. Practicing good hygiene, such as regular hand washing and staying home when sick, also helps prevent transmission. It's also important to stay informed about new developments and listen to trusted health authorities. Emerging infections will continue to be a challenge, but with global collaboration and informed public action, we can mitigate their impact.
Thank you for these insights, Dr. Patel. It's been a pleasure having you with us.
Thank you. It's been great discussing these important issues with you.